Assalamu alaikum. My name is Dr. Iman Musa,
My name is Hashimi.
and we are excited to present to you today our study titled Young, Muslim, and Resilient: Coping Skills and Spirituality in an Islamophobic World. I'm going to start off with our introduction and why we chose to conduct this study and focus on this topic. With regard to Islamophobia and our youth, we're aware that our youth have grown up in an Islamophobic environment. This is well supported in the research and the literature. We know that Muslim students have experienced stigma, have experienced Islamophobia and discrimination within the school setting specifically. And we also know from prior research that stigma, discrimination, and bullying of Muslim Americans has been related to negative mental health outcomes, such as depression, such as paranoia, and psychological distress. And so while we are aware that Islamophobia has negatively impacted our youth growing up in a post 9/11 era, we were also interested to learn how our youth have navigated and coped with Islamophobia and how they've actually built resilience from their experiences. And so that brings us to the topic of resilience. We examined resilience from an ecological understanding. So oftentimes we think about resilience in terms of, when I go through something difficult, how do I maintain my well-being? How do I sustain that strength? And that relates to bullet point A. So the capacity of individuals to navigate their way to resources that sustain well-being. But we know that resilience goes beyond that, further to points B and C, which relate to our social ecology. So how do we build resilience, not just within an individual, but also in their family system, in their school, in their masajid and community centers? And finally, how do we negotiate these resources in a culturally meaningful way? So specific to our community, our very diverse Muslim community, but how do we navigate through Islamophobia specifically for our youth? And so with regard to previous research, there has been studies relating to resilience in Muslim populations, but mainly for adult populations. And these studies have found that resilience is related to seeking social support, finding courage to respond to negative comments, and utilizing community resources. Past research has also found that spiritual coping, or using principles and practices of Islam, has also been related to resilience in the face of Islamophobia. With regard to our study specifically, we use a strength-based approach. So rather than looking at Islamophobia and how it relates to negative outcomes, we were interested in how experiences of Islamophobia actually relate to building resilience and sustaining well-being for our youth. So we hypothesized that resilience and spiritual coping would be positively related to well-being. We also hypothesized a mediation relationship such that Islamophobia, if it did have a negative impact on well-being, that relationship would be explained by resilience. So youth with greater resilience capacity would not be negatively impacted by Islamophobia.
So for our methods, our study used a purposive sampling strategy to recruit from participants at a local private Islamic school based in the Midwest. We recruited them using emails and physical letters home to parents of all students in the 8th grade of that school. Parents had to then review, sign, and submit the consent through an online form. Our study itself included 2 portions: a survey portion, which took about 20 minutes to complete, and then a focus group, which took about 35 minutes. The study took place at the school for convenience and access for the participants. And we also utilized a 2-step method in which the first day we introduced ourselves at morning assembly. We met all the students and the personnel there. And then we spent that morning doing the survey portion. And then the second day we came a week or 2 later, we conducted our focus group. For our sample, we had 18 students participate in the survey portion of the study, and then 8 students participated in our focus group. We had 5 males and 13 females, and participants were all in 8th grade, and their ages ranged from 13 to 15. For our measures, we had 4 different subscales that we had obtained from a variety of sources. The first was the Child and Youth Resilience Measure, or the CYRM, and it had 3 dimensions of resilience: the individual capacity, relationship with primary caregivers and parents, and then contextual factors, which got at the ecological aspect that we referred to earlier. So questions related to, do you talk to your family about how you feel, which was the relationship part, and then do you like the way your community celebrates things, which is getting at the community contextual area. And then for our Islamic positive religious coping subscale, some sample items included: when I face a problem in my life, I look for a stronger connection with Allah, or when I face a problem in life, I do what I can and put the rest in Allah's hands. We also utilized a well-being scale, the Adolescent well-being scale, which had 18 items related to different aspects of adolescents' life and how they feel about themselves. Sample items like, I look forward to things as much as I used to try to understand their well-being. And then we also, for the purpose of this study, created an experience of Islamophobia subscale, which was open-ended, trying to understand the experience of Islamophobia that they may have had or their own personal encounters. For our focus group, we created 8 questions that we utilized past research to create, and they were used to guide the discussion with the participants. We had a focus group was guided by a research investigator who identified themselves as Muslim and was also a trained mental health professional. And then the questions are listed here, and you can see questions like, what do you do when you face difficulties in life, is getting at that coping aspect. What do you think of when you see images of Muslim in the media? It's also trying to understand that community and ecological area.
All right, so moving to our results, I will start with our quantitative results. So when we looked at the resilience scores of the youth, they actually did have above average resilience scores compared to other past samples who have used this measure. And we conducted regression analyses and found that our first hypothesis was supported. So resilience significantly predicted well-being. The youth in the study who had higher resilience scores, meaning they had those individual, family, and community resources to cope, also reported greater well-being. Regarding our second hypothesis, we did not find a direct effect of Islamophobia experiences on well-being, and therefore our mediation analyses were not significant. So that hypothesis was not supported. Moving to our qualitative themes. So we got a lot of interesting data from the focus groups that we conducted with the youth. And so starting with personal coping, the participants discussed how having a lot of confidence in who you are, and particularly kind of explaining and fielding questions from others, was very much key in succeeding and thriving in an Islamophobic environment. So you can see, even in this quotation, the participant is talking about having to go through high school and kind of explain aspects of her religion. So even though our sample was at a private Islamic school, many of the youth were entering public high schools. And so even in preparation and anticipation of being in the public school, she was talking about kind of needing to explain certain concepts like praying and fasting. And they talked about having not just confidence, but patience, because this could get very frustrating, having to constantly explain these ideas to others when there are so many stereotypes and there's not a lot of positive representation. So that was something that really came up. With regard to family coping, the youth did discuss how it was helpful to be able to talk to their family, especially when they came across situations that maybe they didn't know how to handle. So having that open communication in family that, like it says in this quote, oftentimes I have no idea what to do, but then other people do. So being able to go to their family and say, this situation came up in school, how should I handle it? With regard to community coping, so as we mentioned, this study was conducted at an Islamic school, and we actually held the study in pretty close proximity to the shooting at the New Zealand mosque. So that tragedy had just recently occurred close to last Ramadan. And the students discussed how there was a vigil held at school where the school community came together and prayed for the victims and discussed the event. Other aspects of community coping, you can see in this quote, it says, "This Ramadan, there was so much security at the masjid." And so with Islamophobia, we also have that threat of safety. And so this was more of a practical aspect that the students discussed, that the mosque took measures to make sure that there was security and everyone felt safe. And that's what came to mind for the youth when they thought about their community. We also found themes of society and media. And so this was an interesting theme that the youth discussed a lot. Not surprising that social media, television, all of that for teenagers is very important. And they talked about how this was impactful for them for better or for worse. So when there's negativity in social media, which they did report that they saw a lot of, that was really difficult for them. But at the same time, positivity in the media through representation of Muslims or even through support on social media was something that they found really positive. So you can see in this quote as well, this is also in the context of the New Zealand tragedy. The participant is saying they were very shocked, and they were also interested and surprised to see that other people were posting about it, non-Muslims as well. So seeing that, you know, a Muslim issue and tragedy was gaining support from the larger community was something very helpful for them. And in this quote, you can also see "not expected." So she said, "I thought people would say, oh, they probably deserved it." So kind of anticipating that negativity, but being very pleasantly surprised to see positive support.
So as you can see, we have so much to learn from our Muslim youth and their unique experiences. We found that representation in the media and understanding from their fellow peers was really important. And we also found that confidence in explaining Islamic concepts was really related to, was a way of coping for them, and it was related to their strength. And support from family and community was also very key. Some limitations, we recognize that this took place at an Islamic school, and so that environment's not particularly generalizable to the overall Muslim youth in the country. And with that, we also had a small sample size. Future actions, we really hope to expand our study to a more generalizable population, ideally in a public school. And for clinical implications, we really hope that this sort of study helps to create interventions that move beyond the therapy room. Having things in the school, community interventions can really help people or youth feel supported and really learn and build on those strengths that we know that they have, and the resilience that they've had from facing adversity and Islamophobia every single day.
All right, so that is all we have for you today. We look forward to discussing and fielding questions. So thank you.